My name is Mukesh Soni. I've been qualified for 30 years, over 30 years actually, qualified at Manchester University. I did dentistry and it was the best decision I ever made in my life. I love my profession, I love my job, I love what I do. I do a lot of oral surgery, I love oral surgery, and I've been placing implants for 25 years. We have bought a practice about 16 years ago in Twickenham. I started my own dental implant course called Practice Implantology with Sam Mohammed and Azza Sheikh. We've got a great course, and it's a course where we share our successes and failures. We want to work with people who've got our back. We want to work with people who are going to help us. They may not be the cheapest, but the quality you get over that period of time from their support has been second to none. I hadn't heard about Blueprint Dental, and I met them at this prestigious meeting. There was a big meeting going on, and I thought, where has this person been all my life? Shiraz and his company filled in so many things in my life that I wanted. I wanted to be with a friend. He's a friend. I wanted that knowledge. I needed that knowledge a long time ago. The knowledge was phenomenal. He's accelerated my digital experience. Otherwise, I probably wouldn't have gone digital if it wasn't for these people. I needed this person in my life a long, long time ago. I am very analog orientated. I've been very resistant to digital change. And that's why we're sitting here today, that I've gone digital. Sony has gone digital. Now this is big, these are big words. And if you talk to people, they will laugh. I'm meant to be an implantologist and I never had a CT scanner. The worst decision I made in my life, that I didn't have a CT scanner. I know I've lost a lot of cases. I know my profits have not been what they should be. I didn't think I was going to be buying their CBCT machine. I didn't think I was going to get an intraoral scanner from Blueprint. I didn't know what I was going to be doing. But they showed me their systems. They were very open. They showed me their software. They showed me how the software could help the patient get better treatment, quicker treatment, more accurate treatment, more accurate CBCT scans. There are kind of algorithms that the Planmeca system has, meaning calm, stopping scatter around metal artifacts. I'm finding using the software is quite easy. Anytime that there's a problem with anything, I can ring someone. I've never asked a question to Shiraz or Chaz which they've not been able to answer. I've not looked back since they installed the equipment about 2 months ago. It has changed my life. And I wish it happened long time ago. Yeah, the reason I went for the Planmeca Pro Max 3D, I knew about it because we were at the facility and they explained to me about all the great algorithms they had within the software to help the patient and to help the practitioner in a very systematic way. I wanted our students to be able to place an implant 50 times before they saw the patient, before they actually cut the patient, before they actually treated the patient. And you can do that with digital dentistry. So I was talking to Jonathan one day at Planmeca. Then he explained about this one algorithm called CALM. Now, anyone who's been taking panaurals through their life, they know that the patient sometimes moves. They know that the patient will sometimes move their shoulders. So let me explain CALM a little bit more. If a patient does move, when you go to the CBCT and you look at it, it will be distorted. The head will have moved. That means that the X-ray will be fuzzy. I think that's the easiest way of explaining it. Their algorithm will actually make it clear, will stop the distortion. I mean, I've seen it in use and it is amazing. And when he explained this algorithm, I suddenly realized that if the patient did move, I wouldn't have to retake the CBCT. I would not have to irradiate the patient. Wow. Now I'm happy. They've got this low radiation dose, which was actually less than my original PA machine for PAs when I first got it. It was so low, and it's still diagnostic. I can use it diagnostically. I thought, wow. I actually felt that I was doing harm to my patients if I didn't use this machine. I really felt that. And I don't want to go into this because I don't think everything should be marketing, but as a practice builder, for me to say on my I got a CBCT in-house. I didn't realize I'm getting referrals. So I'm not going to say it's paying for itself, because what I'm actually going to say, it's more than paying for itself. It's more than paying for itself. I wish I had one 10 years ago. I went to the Planmeca building. It was easier to see all the machines that I wanted to see. But then what happened, Jonathan said that, look, we can actually come down and take some CBCTs for you at your practice. And I went, what? And he goes, we've got a van. In that van, they've got all their machines. So they came down, I had some patients set up. They took them in the van. They showed me how easy it was to use. They showed me how the software is going to be used. Wow. Anyone can do this. Anyone can ask them to come down. They'll be more than happy. Book it, because it's getting busy. I bet it's getting busy, but book that van. So you've got a chance of trying it out before you actually have it at your facility. It's a great thing, and it's a great day for the surgery. The surgery like it. They suddenly think, wow, what's happening here? This van's come along. And everything's in there. They've got their intraoral scanner, and they've got their milling machines in there. Everything's in that machine. I've been around too long to really try out things and try out people. So I have to make sure I choose the right partners right now. Shiraz and Blueprint, anytime I've rung them, they've been there for me. I've got this surgical light over there. He came down, he spent with his partner 4 hours trying to fix this surgical light for me. And it was just like, then a mission for them. We want to do this. They couldn't do it, so they took it home to their facility, said, we're going to sort this out. And it's now working. It was early days, but I thought, wow, that's the kind of person I want. Because if we don't know how to do it right now, and I've never had them say that, we're going to work out how to do it. And that's what they've done. So I know it's a bit kind of colloquial, but I think they've got my back, and they don't have anyone's back. And I'm more than happy to recommend them. More than happy to recommend them to anyone.